he's got multiple sclerosis, attacks the myelin sheath in the brain. And with the sheath injured in the brain, that causes more severe problems. He has a foot drop, he has trouble walking, he needs to use a assist device, he uses a cane to ambulate. In his 30s, when he was younger, he was a marathon runner, but now at this point, he can no longer do things like that. He can barely take a walk with his dog. He uses a cane to ambulate. However, he has a new incredible device. Now, I have no relationship to this company, Cionic. I just heard about it from my patient. It's a they call it the Cionic Neural Sleeve. Now, the founder tells a great story. His daughter has cerebral palsy, and in watching his daughter walk, he realizes that maybe there's a better way. Maybe we can do some stimulation for her to walk. Now, functional electrical stimulation has been around a long time. I remember videos of Bruce Lee using that to work out his abs. So this is not something new, but what is new is applying it with this kind of small sleeve. It's an exoskeleton, but not a rigid exoskeleton like Iron Man. This is an exoskeleton that's really soft, it's pliable, and it's just providing a little bit of EMG stimulation as he walks. And listen to my patient just rave about the benefits.
And for me, with foot drop, it's the shin muscle is primarily where it really helps me. I walk the same walk every day, and without the sleeve, my foot shuffles and scrapes the ground a lot, and with the sleeve, I'm able to take accurate steps and go for a walk where my foot doesn't drag and it takes away the fear of falling. So it's helped immensely in that area. 25 to 30 years, and this has given me more hope than probably anything else along the way. But I feel like this is the first phase. It's like the old cell phones that were in a bag that we carried around. And I'm like, what's going to be 5 years from now? This will be so exciting to see what they can come up with.
Now, when I was young, I used to watch The $6 Million Man. This was a great TV series, and it was about a man who was injured, and then he was repaired, and he was given $6 million worth of bionic equipment to make him stronger, to see better. And Cionic rather than Bionic, but still it's really interesting. What a great and incredible time we are. We now have a $6 million man right here with a Bionic or a Cionic sleeve. So it's pretty amazing. He's only had it for 4 weeks, so long-term benefit over time. It'll take time to know the true benefits, but it's a really exciting technology. We're in this really wonderful time and world. All right, this is Dr. Lee. I'm here with Bill Runzer and his wife, and he's very interesting because he has MS, multiple sclerosis, and he has some challenges with his right foot, and specifically a foot drop. But he has this amazing new technology.
It is Cionic Sleeve, and it's a device that you wear. It's a sleeve that fits on your leg, and it stimulates the muscles in your leg. So hamstrings, quads, calf, and your shin muscles. And for me, with foot drop, it's the shin muscle is primarily where it really helps me. I walk the same walk every day, and without the sleeve, my foot shuffles and scrapes the ground a lot, and with the sleeve, I'm able to take accurate steps and go for a walk where my foot doesn't drag and it takes away the fear of falling. So it's helped immensely in that area.
So you put it on, does it feel like just a regular, like a stocking or a...
Yes, it's like a sleeve, like a basketball player might have a sleeve on their arm. It's like a Lycra type of sleeve, and it's got pads that are the electrodes are in the sleeve, and there's pads that then send the electrical stimulation into my muscles. But it feels just like a comfortable sleeve. You wrap it around, you have to place the pads carefully so that they hit the right spots. But then it's Velcro closure, and there's a little bit of a control device that fits in a pocket, and when you plug it in, there's an app on my phone, and it monitors what I'm doing. And as I'm walking, it monitors my gait and provides stimulation as needed because it can calculate what stimulation is required and gives it to me so that my walking is improved.
And where's the battery?
It's the control unit is, I plug it in and it recharges. So when I take the sleeve off, I take the control unit out, I plug it in, it's not much bigger, it's the size of a phone, it's just a little thicker and heavier, and it fits in the sleeve.
And how long do you walk for?
I walk for 15 to 20 minutes a day, but I try to wear it for like 4 hours. I go out and I walk my dog around the yard, and I'll wear it, and I can do they have a series of different exercises, like I can do toe raises and heel raises, and their sleeve will help those muscles work. And why I find it most beneficial and everybody does is because I can't do those exercises without the help. But with the electrical stimulation, now I can do those exercises and make the muscles actually do the work so they strengthen and get more towards normal, which I've been losing normal for a long time now.
And we are kind of finding that as he wears it, if there, for example, yesterday he didn't put the sleeve on and he went for a walk and there was some improvement prior to ever wearing it. His brain's kind of learning how to make his body function again.
That is incredible. How long have you been diagnosed with MS?
I've been diagnosed for 24 years. I've had MS for at least 30.
And what symptom did you first notice? Like, how did you...
Numbness in my feet.
How old were you at the time?
30 years old.
Wow.
And we were running marathons, we were running 5Ks, 10Ks, running all the time, and it's kind of seasonal because the heat bothers me. So in the summers, I'd be like, boy, my feet feel a little bit numb. But I was still running and doing all that, but each year I would say I lose 1 or 2%. Well, after 30 years, I'm not running anymore. A 15 or 20 minute walk is about as good as I can do because I've just been losing it, and the sleeve is helping me to regain a little bit, and while I wear it, to maximize what I can do now.
That is really incredible. And then when the sleeve fires and pulls your leg up, do you feel pain?
You adjust it to be appropriate stimulation. So I feel a tiny bit of pain. It's a little bit of a burning sensation, but it's not bad. And if you don't like it, you can reduce the settings. But when I fire my shin muscle, my toes raise. If I was wearing it right now, I could press the button to test it and my toes would lift, and I didn't do it because it sends the signal to the muscle that says lift the toes, and my toes will lift. And that's what it's doing while I'm walking. It's evaluating my stride, and it provides stimulation where needed, and specifically my toes lifting because otherwise I trip and fall.
So as you're walking, it's trying to calculate when it needs to fire?
It does. It's constant evaluation. There's two pieces. Their marketing people are better at this than me, but they have constant evaluation while I'm walking, and then functional electrical stimulation where it's needed. And I feel it. Like, I just get up from a chair and I feel my hamstring a little buzz, and then my quad a little buzz, and then as I start walking, I just feel these little buzzes because it's like you need a little help here, you'll need a little help there. And I'm going to try to start doing exercises where I realized the other day that my hamstring is a little weak on that leg, and I'm going to start doing exercises that focus on that, and I'm going to wear the sleeve because the sleeve's going to help me to actually do the exercises properly and strengthen that muscle. At least while I'm wearing the sleeve, I can be sort of closer to normal, and then hopefully when I'm not wearing the sleeve, I'll still be closer to normal. Then I'm just battling whatever the long-term effects of MS are, but it isolates the parts that are bad and lets me maximize the parts that I can still do.
When was the last time you ran?
At least 6 or 7 years, but the other day during my walk, I ran for like 100 feet.
And how did this thing work with the running?
It was a lot of zapping going on.
Okay, all right. It's not yet at the running
But
stage.
no, it was good actually, because it was like you're moving and it was analyzing it, and it was helping my leg the whole way, so that because this leg is probably at 60% of what it should be, depending on which muscle, and this helps it to function properly. So then the muscle actually has to do the work because it gets the signal. Because with MS, my muscles don't get the signals properly.
So without the sleeve, you walk with a cane.
Yes.
With the sleeve, you don't need the cane.
I still walk with the cane it makes me feel safe, but I don't rely on it nearly as much.
Amazing. Who prescribed this?
It's if you get in touch with Cionic, they give you all the help to get there, but I had to get a form, and I took it to my doctor, and he had heard about it a little bit, and my neurologist, and he was fully willing to sign it because it's not invasive, it doesn't harm you, it's a device that you wear, and it's approved, FDA approved, and I have frequent video calls with somebody who helps me, a support person. So like once a month, they just give me guidance, what exercises to do, are my settings proper, how to use it. And I've only been at it for a month, and I'm getting pretty good at it.
And what do you use the app for?
The app is, when I'm going to go for a walk, I put the sleeve on, and I make sure that it's in the right place on my leg, and then I press the app, and it says gait assist on the app, and that knows that I want to walk now. So it knows that those are the types of stimulation I should do, as opposed to just simple toe raises or lifting leg lifts. So then it knows to monitor my gait and provide stimulation as needed. It measures how many steps I've taken and my speed, and I can see that my stride length and my speed have improved. I've gone from like 2.2 miles an hour to 2.4 miles an hour in the last month, and I've only been doing it for literally 4 weeks.
Amazing. Oh,
I'm brand
weeks.
new with this.
Yeah.
Oh, this is super exciting.
Yeah,
I
I'm
can't
excited.
wait. Yeah,
It was the Time Product of the Year,
Yes.
Invention of the Year.
Yeah, Time Magazine
yeah.
Invention of the Year, and several other awards.
Yeah.
It's very exciting, and I've had MS for, as we've said, 25 to 30 years, and this has given me more hope than probably anything else along the way.
He only wears one sleeve, but some people we've learned who use the product can use two. So
Yeah.
if both legs are affected, and his hip flexor is really an issue for him. So there's nothing currently that this company can do, but they're working on additional products.
It's
to
hard
help
to
additional-
stimulate the hip flexor.
Yeah.
Yeah, that muscle's so deep.
Right,
Exactly.
so
Yeah,
they
the
said that there's
iliopsoas.
something in
They're
R&D
working on it,
right
we'll
now.
see.
So.
Man, great. Well, this is really great. I learned something new today, and I'm excited to share this with my audience, because the more people we can help with technology, because technology innovates so fast. Drugs, I think, move at a certain speed. Biologics happen at a certain speed. Genetics happen at a certain speed. But technology, it's just flying. And for you to be able, soon one day they'll be able to tap into your brain and do this.
Right.
And I mean, it's incredible.
I agree, because I'm thinking that I feel like I'm wearing a prototype. This is a new product, and it's good and it works, but I feel like this is the first phase. It's like the old cell phones that were in a bag that we carried around, and I'm like, what's going to be 5 years from now? This will be so exciting to see what they can come up with.
Well, thank you very much for
Great.
sharing your enthusiasm with me. So,
Thank
yeah.
you. It's a pleasure.
Thank you for helping us to share it with others too.
So peripheral nerve injuries that happen in the nerves that are far out, the nerve can recover a centimeter per month, so there are opportunities for recovery for these nerves. However, when the injury is in the brain, that signal has to travel from the brain all the way down the brainstem, spinal cord, all the way through the peripheral nerves into your arm or into your leg. And that kind of regeneration is not very easy and usually considered not possible. So my patient who has multiple sclerosis, he has a demyelinating plaque up in the brain, so he cannot send his signals all the way down to his leg. Well, that means he's functionally paralyzed in that leg and cannot perform the activity that's needed to even conduct a normal walk. So can that be bypassed by this Cionic sleeve? If you think about walking is actually quite a complex task, because it's not just firing a big muscle. There's also all these balance elements to it. And balance requires an intricate play of your sight, your vestibular system, the little muscles. There's so many muscles in your feet and in your legs that have to work in coordinated fashion to stay balanced. So clearly this is just the beginning. Firing a crude muscle is not going to solve all of the balance problems that are needed for walking, but I am pretty excited about this first step, the Cionic Neural Sleeve. Whether it will stand the test of time, I mean, we don't know, but I'm pretty excited for this technology. Even my patient, he recognizes that this is the first generation. Who knows where the second generation, the third generation, and how much more complex it will get.